All right. Hi, folks. My name is Eliseo, and I have with me Meredith Ximenes Mullings. She's a nurse, and I have been seeing the great things that she's been doing in Florida. And I just wanted her to share with us what she's been doing. Meredith, tell us about you and what you're doing in Florida with Medicare and nursing.
Hey, Alicia, thanks for having me. So real quick, so I've been working with Medicare patients in the insurance space, which is a little bit different. But to be honest with you, I've been utilizing so much of my nursing knowledge, just doing those medication reconciliation, helping clients to find primary doctors, to find specialists, coordinating transport to hospital. So pretty much a lot of the things I did as a case manager at the bedside, I can do that and help even more clients on an outpatient basis.
What were you doing as a nurse before? How did you start? And what's the highest level you've gotten so far? Did you get your master's as well?
Yes. So actually, I do have my master's in nursing leadership and management. Half of it was actually as a family nurse practitioner, and then life happened, and I had to take a detour there. But most of my career has been in critical care, specifically emergency room. I did do some case management as well and education. I absolutely love education. So a big part of the Medicare insurance coordination program is education. It's educating the clients, educating their families, educating even providers, even healthcare professionals, because there is a big gap between what people think of when they think of healthcare and reimbursement and what is covered and the reality. So it's a lot of education. I think 99% of the job is education.
Yes, and you and I have seen each other through a lot of Facebook groups, also in case management and nursepreneurs, and also a lot of Medicare insurance groups. Um, we seem to bump to each other a lot, right? And we were answering all these questions, and we have um, answering all the nurses' questions and how to start what you're doing, but you actually doing that full time. What made you get into the Medicare niche?
You know what? I would say the Medicare niche found me. you know, I had no idea that, a position or even a job like that, was even in existence. I didn't know.
Mhm.
So, I was just burnt out at the bedside. And I was at the point where I was just ready to be over with nursing. Like I was done. And I was talking with one of my colleagues, and she was saying, hey, if you got a license, you can actually do health insurance, not health insurance, life insurance.
Mhm.
So I did go ahead, I did my license, I did my life and health. It's a combination program. So I got both licensed. I tried life insurance for a little bit. I started attending all their meetings and, started learning, but it wasn't, I just didn't enjoy it. It wasn't me. So then I said, how can I branch into just learning the Medicare part, the health part? And then I saw this conference online advertised in my area. I showed up and everything that they were saying just like hit me. And I'm like, yes, this is it. And I went all in. I went all in. I just dropped everything and I, opened the actual brick and mortar location, but of course it was also new. It was new. Business was new for me. Marketing was new.
Mhm.
Everything was new. And I
Right.
thought as soon as I got in, then people would be coming from left, right, north, south, east, and west, right? But it didn't happen that way. So I started having to learn how to network,
Mhm.
how to create promotional items or to market, how to get in front of your target group. And you know what? No matter which business you endeavor, any area, you have to know these things because most times your patients, not patients, but your ideal market won't find you unless you show up.
Right. And a lot of the conversations right now, especially with the pandemic, they're talking about the burnt out nurses, and seeing that it's estimated by 2034, there'll be about 78 million baby boomers age 65 and above. What type of opportunities are available in the Medicare niche for nurses, do you think? Do you think that somebody can follow what what you've done and can make a business out of this?
Absolutely. And I think the sky is the limit here as well, because, I've worked with even medical practices.
Mhm.
They need, they call them member retention or member, what's that word I'm looking for? Where they actually recruit members. And it's important that they understand the Medicare periods, the Medicare plans. So I work very closely with them. A lot of times they'll get on the phone and like, Meredith, I have this client, they want to join the practice, but we don't accept this plan. Can you change your plan? Or they're looking for this, can you check if it's covered? So there are a lot of opportunities. So you don't, even if some persons are not interested in the sales per se, they can do consulting, they can do educating, they can actually facilitate even different workshop or programs. And there are newer programs now to help Medicare clients stay in their home for longer. So there are case management services. There are just so many spin working with this Medicare, this growing Medicare population that nurses can pretty much piggyback and make something profitable from.
Can you share how your case management background helps you as a Medicare insurance coordinator? That does looking at their medical records per se help you out and go deeper into helping them out maneuver Medicare?
Absolutely. You know what? To be honest with you, prior to doing case management, I was literally clueless about Medicare,
Mhm.
right? So I worked the emergency room for, over a decade, and I didn't care about that. My primary focus was treating their emergency or treating the medical aspect. Whenever they asked what medicine would cost or whatever, or how much they would, you know, how much they can get, they would expect to get paid or to pay for the visit, I didn't know how to answer that. That wasn't my business, pretty much, right?
Right, right, right.
So
We always
when
refer it to the social workers and the case managers and
exactly, or
right.
secret registration, or when you
Mhm.
get the bill, or my statement would always be focused on the health care needs now
Mhm.
and think about the bill after. So that has always been my thing. But when I transitioned into case management, everything started making sense because we had to check when we were doing like discharge planning. We had to check how many days they utilized already within a benefit period. I was like, benefit period, what's that?
Right.
And then they were like, oh, we're trying to discharge them to the skill facility, but they have exceeded their 20 days and now they have to pay for day 21 moving forward. And I'm like, okay. And then another client came in and he was like, I'm on disability and I was on Medicare, but now I start working and I will lose my Medicare at the end of the month. So I'm like, how do you get Medicare and then lose Medicare? So there were a lot of putting together pieces that I had to start saying, okay, so this impact this, which impacts this.
Right.
So then I
Right.
had to start putting the pieces, but doing the training, the insurance training actually just brought it everything together. It was just like fitting the puzzle pieces together.
Right. And so the other things that you would also see, especially when you're working in the emergency department, your colleagues start knowing that you know Medicare and they start coming to you to answer those questions, especially for their parents. So how does the knowledge of a Medicare insurance coordinator help a nurse's personal retirement plans? And So how can it be useful to help their elderly neighbors per se, or their own two sets of parents, let's say? How does Medicare, knowing about Medicare, help them out?
It helps tremendously because most of us, I'm sure if we can count, we know someone who is 65 and over or who's
Hmm.
on, Medicare. The church that I attend, like 80% of the population is over 65 there. My neighbors around me. So almost everywhere you go, someone is come in contact or at some point with the
Hmm.
healthcare system and they have questions about coverage. So just having the basic knowledge as a nurse, I'm not saying know all the details, but having the basic knowledge is like super important. And even if you're not interested in knowing everything, personally, know when to refer someone.
Right.
And that is so important because I've seen nurses, and trust me, that's probably one of my biggest pet peeve. I've seen nurses say, drop your coverage, don't do this, and go on whatever plan or go on original Medicare because it's easier. When a client comes in with original Medicare, it's easier for the healthcare professionals to get whatever done. When
Hmm.
they have to go through authorization and everything through the managed care programs, that's more work. So no one, it's not favorable for many people to be on managed care. But the point is, if healthcare professionals understand what these programs have to offer and how they impact the client, then they'll better be able to help the client coordinate those benefits. So knowing when to refer a client for professional services or consultation, I think is probably key when dealing with healthcare professionals.
Yeah, I agree. And it also makes you a better nurse, don't you think? That you're able to know where your lane is, and also you can follow the steps as to who to refer to
Mhm.
out in the community, and you gain the trust of all your community care referrals, especially when you're an emergency room nurse case manager. You agree?
Absolutely.
Okay. Now, one of the things that I think if nurses were to want to know more about this program, you have a training program, and you train them. What's the process in getting to get that information? And yeah, tell some of the nurses that are interested in becoming a Medicare insurance coordinator.
That's a great question because the program has, I started out with one method or one module, and it
Hmm.
it keeps evolving because I'm realizing that training a nurse, someone who is working versus someone who is not working, is difficult. Training someone who is hands-on versus, just a audio learner is
Hmm.
different. So it's like there are so many factors, and then I think the motivation behind one wanting to branch out is also very important.
Hmm.
Um, the population that someone would prefer to work with is important as well. So there are so many factors. So I do have a coaching program, but now I've been very selective in who,
Right.
because you know what, it's time consuming to give your all
Hmm.
to pouring into someone building or developing a business from scratch. And if they're not go-getter or driven, it drains you personally if you're trying to
Absolutely.
do the best. So right now it's really just I try to screen those who are, who I'm gonna work with. And I prefer to just work with a handful of persons than open it to 1,000 people, and then the success rate is just poor, because whatever I do, I want to do it well.
Right, right. And for those who nurses that are interested in figuring out why we're both pursuing this, the Medicare insurance niche, um, I feel that the major benefit of selling Medicare insurance is that it pays your residual income, right? Tell me what residual income is and how has it helped your business? And do you feel that nurses should make a priority to get a residual income as part of their multiple streams of income for retirement?
Absolutely. Absolutely. You know what? There's nothing better than waking up and seeing money in your account that you don't recall working for.
Right, right.
Right? And it is just so rewarding and fulfilling, to know that, especially if all you knew was working 12 hours or 8-hour shifts or whatever it is, to know that, you know what, 2 years ago I signed up this couple
Hmm.
on a plan, and they're still on a similar plan or the same plan, and I'm getting paid for it every month, right?
Right,
And then it's just a building step by step.
right.
So each time you build, your residual income becomes greater until you reach a point where your income is equivalent to what you earned as a nurse
Hmm.
working full time, but now you're not working for it. All you have to do is probably check in on that member, send them a birthday greetings or just ask if everything is okay. And there you go, right?
Right,
So
right.
the residual part is very, very, very important.
One of I don't know if I told you this, that my wife, so instead of saying, let's say, a name of the carrier, uh, where we get our insurance from, the hospital, my wife was just putting these envelopes from the company because I forgot to do direct deposit.
Hmm.
So I opened, she gave me those envelopes, and they contained about 5 checks, the residual
Wow.
income that I had. So I had to take a picture, and she was wondering, where did all those checks come from? And I said, oh, it's the ones that I've written before, right?
Hmm.
And so I had to take it in sequential dates because I was like, I don't even know who I wrote this for. And yeah, so
Exactly.
those are the types of surprises you want in your mailbox.
Hmm.
So I immediately went to make a direct deposit. So that, yeah.
Well, you know what? The same thing happened to us. My husband did one, and it was like the check was older though. I think
Mhm.
they're avoided after 90 days or
Yeah.
180 days or something. But this we missed that one. So it's like I wonder if I should call them up and but
Right.
yeah,
Right.
it's nice to actually continue reaping the rewards even months later. And the good thing is it can be done part-time because you
Yeah.
work full-time
I'm
still.
a full-time case manager in the hospital, and I'm
Exactly.
doing it part-time.
And really, like, I'm doing so many other things now that it's
Hmm.
really part-time. If I tell you that I spend 5 hours good per day,
Yeah.
that's a lot.
Yeah.
But you know what? You have to get started. And then once the referrals will start coming, and
Hmm.
someone who knows someone, or right now I think most of my referrals are coming from home care, and
Right.
they're saying, hey, Meredith, we want to start treatment on this person, but this and this and this, or, what would you advise, or whatever it is. So sometimes it's not every consult will result in you becoming the agent or whatever, but that's okay. It's a
Right.
numbers game, just like
Right.
everything else. Not 100% will convert, but when it does, it will be worth it.
Right. They just need to know that, in fact, some of my coworkers, the other nurses and the housekeepers, and even some of the administrators come to me and said, hey, you know a lot about Medicare. I'm about to retire. Can you tell me what I need to do? And same thing with the secretaries that come to me. In fact, one's going to retire in June, and she said, hey, whatever you tell me, I'm going to do. Right. So that's how it kind of just adds on.
Mhm.
And I know that, like, for example, you're doing this part-time, and you have an appointment soon after this, and then you move along and take care of the family, right? So that's how, once you kind of get the knowledge and get comfortable in it, and you hang around the Facebook groups that we do and talk to other nurses and explain this opportunity, it gets easier,
It does.
and you get known in the community, whether
Yeah,
it's your local city or all Facebook groups, right? So
absolutely.
I want to respect your time. I know you have an appointment after this, but is there any other questions that I didn't get to ask that you would like to let the other nurses know about this opportunity?
I know a lot of persons always ask, how much time do I need to commit or how much money do I have to put in up front? And
Hmm.
I would just say it depends. I've had persons go through the entire process in under 2 weeks in terms of getting licensed, starting their certification. After the certification, it will take a few more training for you to become appointed with the different carriers. So definitely give yourself at least 30 days. And then in terms of startup investment, this is probably one of the cheapest,
Right.
the
Absolutely. Right.
cheapest, absolute
The
cheapest
cheapest.
business to start because you don't need anything more than a telephone, which most people have.
Hmm.
Um, you may or may not use Zoom depending on, if you're doing face-to-face versus virtual meetings. And marketing material is usually provided by the carriers that you
Hmm.
represent. Yes, you can get some business cards for networking, which is $20, $8.99 if you get one of those specials. So be resourceful, network, and if it's something that you're definitely interested in learning, then again,
Right.
network with those who are doing it already, and don't be afraid to invest in yourself.
That's awesome, Meredith. How can other nurses get a hold of you?
Well, on Facebook by my full name, just as it appears on the screen right there. I do have a Facebook group as well. It's Busy Savvy Nurses. I'm on LinkedIn. I don't do Instagram as much, but I do have a link there. It's Medicare Niche RN. So if I don't post anything, so don't even follow that. But
Yeah.
whatever, you know. But yeah, I'm available and you can also text me at 407-814-3422. That's my business flash, but it also has text message capabilities. I prefer text message because
Hmm.
I can respond even later. So
Hmm.
text 407-814-3422. Just leave me your name and I'll be happy to send you some information.
Great, Meredith. Thank you very much for your time, and I appreciate all the hard work you're doing and helping your community. And we'll talk soon.
Absolutely. Thank you so much for having me.
Bye bye.
And we're matching
I
colors.
know. Can you believe that? That's awesome. All
Right.
right. Bye
All
bye.
right. Take care. Bye bye.